Let's check in on the vaccine and some of the issues regarding its rollout around this country now. And across to Adelaide and catch up with Dr Chris Moy, who's the Vice President of the Australian Medical Association. Thanks for joining us, Chris. I appreciate it.
No worries, Chris.
First up, the sense that people are getting very frustrated about getting the vaccine and rolling it out quickly in Australia. Oughtn't we be pretty relaxed in this country? It is summer. We don't have the virus very prevalent in our community. And we can look and learn from the rollout of the various vaccines in Europe and North America.
Yeah, I think the main thing from the Australian strategy is to ensure that we do things properly and don't cut corners, particularly with the approval process. So Australia is actually the first country to actually approve the Pfizer vaccine under sort of general classification, not on emergency provisions, because we're not in an emergency situation. So the whole approval process that would normally go for any other vaccine has been followed, and that will be the same for any other vaccine because we have luckily been given the breathing space to do that. And that's really important from the point of view of the trust of the community that, you know, when you're offered the vaccine, you know that it will be the same approval process for any vaccine or any tablet you've ever had before because we haven't gone that way. Plus, as you said, we get the great chance to watch about some of the mistakes and how it's done overseas, because there have been some problems overseas in terms of the rollout, the logistics and the practical issues of the Pfizer vaccine. So, yeah, no, it's been good from that perspective that we've had the time.
Yeah, the timing is very good for us, but it's very important to think about who's going to be getting the vaccine first. It stands to reason, of course, that people in aged care and people who are working in the health system ought to be at the front of the list. Young, healthy adults, just how long do we hold off on them because presumably their vaccination is more important to get in the process of getting herd immunity rather than protecting them from the illness?
Look, definitely the ones who are the most likely to get severe effects, and that is the elderly in aged care facilities, but also the staff working there. Yeah. And also frontline staff like, you know, hotel quarantine and frontline health workers are the critical ones to vaccinate first. And they're the first off the cab. And then after that, it will roll out to, you know, sequentially the sort of the next riskiest group, and then it'll move down from there. Now, this idea of herd immunity is a controversial one because that's really an interesting point. So one thing to keep in mind, at the moment, the vaccines, all of them, whether it's the Pfizer or the AstraZeneca, all of them have one thing that we're all agreed on, is that they're good at stopping severe disease, people ending up in hospital and people dying. So when you get it, that's what you're trying to stop. There is actually currently no clear evidence or proof that we can be sure of, although it's hopefully going to emerge, about the ability of these vaccines to, number one, stop asymptomatic transmission. That means you get it, you don't know it, or that you catch it and can pass it on. So this idea about herd immunity is actually a secondary goal. That means next off the rank. But it's something that we are looking forward to if we get more evidence about the vaccine. But we can't actually be promising that. There's no big promises about that at this stage until we get more information about what happens with the vaccines.
That's the important thing, to think about this realistically, because it also informs how we need to manage our response to coronavirus, even with a vaccine, to understand that we're still going to have infections and people getting sick months, maybe years to come. Because, for instance, we have a flu epidemic around the world in some place or another every year, don't we? We have new vaccines rolled out every year for the flu. Is it likely that we're going to be battling this coronavirus, COVID-19, in a similar fashion for many, many years to come, maybe decades to come?
And we might. And I think it's been quite clear. The government have actually indicated that, yeah, we've got these first vaccines off the rank, but the strategy will change most likely over time because there's a slew of vaccines coming online later, like Novavax and a whole number afterwards. Some of these may turn out to be better. We may find out that these are better for stopping transmission later. And what they will want may be, we may pivot and start changing to different types of vaccine as time goes on. But really the strategy at the moment is to get out there and protect people, because by making sure that the majority of people are protected and they won't end up in hospital and they won't die, that gives a greater reassurance to everybody, obviously, and that's a pretty good aim. But in terms of actually over-promising about the vaccines, we can't do that yet because it's still quite early in their life cycle, and also there may be changes to vaccines over time. But, you know, these ideas about travel passports and things like that, knowing the fact that they don't necessarily stop transmission, we can't be sure that having one of them will actually be helpful, because you might still catch it and pass it on, but you're the one that won't die, but you could pass it on to somebody else and they could end up in trouble. So there's actually, unfortunately, still a little bit of uncertainty that we're going to have to work out probably over the next few months.
Dr. Chris Moy, thanks so much for joining us.
It's a pleasure.
There you go. Even when it comes to the vaccine, people are seeing this a little bit too simplistically, as if there's going to be a silver bullet and it's all over. No, we've got to keep managing this thing. That's why we've got to be very sensible about the policy decisions and personal decisions we take.